Welcome to The Explainer. Today we're diving deep into one of the most popular surgeries on the planet, LASIK. You know, the one with the lasers. We're going to break down exactly how it works, who's a good fit for it, and what the science really says about that promise of perfect vision.
All right, let's just get right to it. Are you completely over your glasses and contacts? I mean, it's a daily grind, right? Nearsighted, farsighted, astigmatism, whatever it is, that constant cycle of finding your glasses or putting in contacts, it can just feel like, is this it forever?
So, what if there was a way to just fix it permanently? Well, that's the big promise of LASIK. So let's get into what it is exactly. We're going to look at the real science behind how this all works.
Okay, so LASIK is technically called a keratorefractive surgery. Whoa, big words, right? But all that really means is that it's a procedure that reshapes your cornea with a laser. Think of your cornea as the front window of your eye. LASIK uses this super precise laser to basically recarve that window so that light focuses perfectly on your retina in the back. The end result? Sharper, clearer vision.
Now, you might think this is some brand new, cutting-edge thing, but LASIK actually got its first FDA approval way back in 1995. But, and this is a big but, the technology has changed so much since then. I mean, we're talking about a huge leap from using mechanical blades, yeah, actual blades, to these ultra-precise femtosecond lasers. And today, it's even more advanced with custom treatments that create a unique map of your eye's specific quirks.
Okay, that's the history. But how does the surgery itself actually go down? What's happening when you're in that chair? Well, let's peel back the layers and look at the whole thing in 4 basic steps. All right, step 1. The surgeon creates this incredibly thin, hinged flap right on the surface of your cornea. Then, for step 2, they gently lift that flap up, kind of like opening the cover of a book. This reveals the layer underneath, the stroma. Step 3 is the main event. A computer-guided laser zaps away a microscopic amount of tissue. It's all perfectly calculated to give your cornea the ideal new shape. And finally, step 4, the flap is placed right back down. It acts like its own little bandage and starts healing almost immediately.
And you really can't overstate the precision we're talking about here. That flap, the one they create in step 1, with a modern laser, it's only about 100 to 120 micrometers thick. I mean, what does that even mean? Well, get this. That's about the thickness of a single human hair. It's just mind-blowing.
So the technology is obviously incredible, but, and this is a really important but, it's not for everybody. And that brings us to the big question, right? Are you a good candidate? Let's run through the essential checklist.
Okay, so there's some serious boxes you've got to tick. First off, you have to be over 18. Your prescription can't be bouncing around. It needs to have been stable for at least a year. Of course, your eyes need to be in good health overall, and maybe the biggest one of all, your corneas have to be thick enough for the surgeon to work with safely.
And that last point about corneal thickness leads to a super important safety rule. It's an absolute must. After the laser does its thing, the amount of corneal tissue left behind has to be at least 250 micrometers thick. This is totally non-negotiable. Why? Because it's what keeps the eye strong and stable, and it prevents a really nasty complication where the cornea could start to bulge.
This is exactly why the pre-surgery screening is so important. There are a bunch of things that are just deal breakers. For example, if your cornea has an unusual shape or if it's just too thin to begin with, nope. Significant dry eye, that's another red flag. And it's not just about your eyes. Your lifestyle can play a huge role. If you're a boxer or play contact sports, that corneal flap could be a real problem down the road.
Okay, so let's say you check all the boxes. You're a perfect candidate. What's next? Well, now we have to talk about the trade-offs. It's time for the good old-fashioned pros and cons list.
All right, the big win for LASIK is the wow effect. Seriously, the visual recovery is incredibly fast, and there's way less pain compared to other procedures. That's the huge pro. But, and you knew there was a but, the flip side is that you have a very specific set of risks that are all tied to that corneal flap we talked about. Plus, a lot of people deal with dry eyes afterward, and some get issues with night vision, like seeing halos or glare from lights.
And that's really the central trade-off here. That flap is the hero of the story because it makes recovery so quick and easy. But it's also the potential villain because it introduces its own set of unique problems. We're talking about things like tiny wrinkles on the flap that can mess with your vision, or a weird inflammation condition they actually call Sands of Sahara. And maybe the scariest part, that flap can be knocked out of place by an injury, even years after the surgery is done.
Hearing about all those flap risks, you're probably thinking, okay, so what are my other options? And that's a great question. LASIK isn't the only game in town, so let's see how it compares to the other big players in laser eye surgery. First up, we've got PRK. The huge difference with PRK is there's no flap. None. The laser just works right on the surface of the cornea. So the trade-off is pretty straightforward. LASIK gets you seeing clearly, faster, and with less discomfort. But with PRK, you have zero risk of flap complications, which is why it's often the go-to for people with thinner corneas or, those athletes we mentioned before.
Okay, now what about the newer kid on the block, a procedure called SMILE? The big selling point for SMILE is that it's thought to be gentler on the eye. It doesn't disrupt as many corneal nerves, which often means less dry eye after surgery, and the cornea might be a bit stronger structurally. But LASIK still has the edge in versatility. It can treat a wider range of vision problems, including farsightedness, and it offers more options for really customized high-definition corrections.
So when it comes right down to it, the choice often boils down to this. Do you go with LASIK, which can treat more types of vision issues and can be more customized? Or do you go with SMILE, which might give you a stronger cornea and a better shot at avoiding serious dry eye? It's really a classic case of weighing a specific set of pros and cons.
Which brings us right back to the central question, doesn't it? Is that incredible, almost instant wow factor from LASIK, that quick, painless recovery, is it worth taking on the very specific and potentially lifelong risks that come with having a corneal flap? It's a huge decision, and honestly, it's a question that no one can answer but you, sitting down and talking it through with your doctor.